Hello again. I'm Dr. J.C. Smith here in wonderful Warner Robins, Georgia. This morning I want to talk to you about a major law that was signed January 13, 2021. This law passed both houses of chamber unanimously and was signed by President Trump. Imagine that, unanimously, overwhelming. And it was about, the name of it was the Competitive Health Insurance Reform Act, acronym of CHIRA, C-H-R-A. This basically ended the 75-year insurance antitrust laws. For 75 years, since 1945, health insurances, not all insurances, but health insurances, were able to collude and do a lot of other anti-competitive activities. Have you ever wondered, for example, why your health insurance was so costly and so ineffective? How they routinely denied coverages that you were expecting? We see this from some of the federal insurances on the base here, where people sign up for a program, say for 20 chiropractic visits a year, 30 or 40, yet they end up getting 6. And there's no way you can appeal that to it. There's no insurance court, insurance judge. The company that is limiting you are the people who act in that capacity. But nonetheless, they get away with it because, again, this law that was on the books forever, it was called the McCarran-Ferguson Act of 1944, exempted certain monopolistic conduct that constituted the business of insurance, allowing health insurance to operate beyond the reach of federal antitrust laws. The federal antitrust law strictly prohibited such things as discussing with other doctors current or future prices or charges, discounts or cash payments, condition or requirement upon the doctor deals with is willing to deal with an existing proposing participating agreement with any third-party payer. In other words, the chiropractors couldn't get together and say, this company is screwing our patients and us, what can we do? That was considered against the law. But, on the other hand, the health insurance companies had been free to exchange among themselves suggested price information, terms of service, and criteria for reimbursement of doctors of chiropractic. With certain limited exceptions, this ability of insurance companies now ends with the elimination of the business of insurance exemption to federal antitrust laws. It was amazing what these companies are doing. And that's what I want to talk about today, because most of my patients have been affected by this. Like I said before, they'll sign up for a product, insurance product that is, that supposedly gives them 20 visits, say some give more, some give less. But they always seem to they were limited to 6.5 under the gaze it wasn't medically necessary. Well, that's a bunch of baloney. It was necessary, but nonetheless, there was no, as I said, insurance cop who made these companies follow their own policy. And by doing so, they made a ton of money. This one company in particular, it touted itself that it was named, Inc. magazine names American Specialty Health among America's fastest growing private companies for the 9th time in the last 10 years, citing its 99% overall revenue growth in 4 years from $255 million in 2014 to $509 million in 2018. Imagine that, in 4 years this company doubled its revenue stream. How? What other company have you ever heard of that had done that? And I'm not talking about drug cartels or the mafia. I mean legitimate companies. It just doesn't happen because they don't have this antitrust exemption. But ASH covers 140 PPOs covering 36 million people across this nation. And the main thing is they prohibited spinal x-rays. Can you imagine that? Would you go to a chiropractor and you have a back attack and you were told, sorry, we can't take x-rays of you, the insurance company says so. Well, who are they? What do they know about you? Nothing. They know, and the fact is 23 chiropractic techniques require x-rays for many reasons. One, to find out how badly misaligned you are. Two, see any pathologies in there, and then work out an analysis, a diagnosis, and a treatment plan. So suddenly, that's all out the door. So we're supposed to walk in with a patient in severe pain, not knowing what the hell is in there. It could be anything from cancer to fractures, infections, or serious spinal misalignments that we see in everybody, and put a blindfold on and say, all right, let me pop you. You'd probably run out of the office as fast as you could if you knew that was the situation. But that's what this company demands of us, which is one reason why I quit that company. Another thing they do is they limit the number of visits from what you paid for and expect to be getting to 6.7. And then they even bragged about this in a testimony that this company made to Health and Human Services. It was absolutely amazing. Let me find it here, because there's so much information that I have gone over here, but here it is here. In testimony to Health and Human Services, ASH boasted of its loophole to cut patients' visits from 40 or more to a very modest 6 to 7 encounters, unquote. Here it is. A medical necessity governed chiropractic benefit could allow for coverage of 40 or more chiropractic encounters per benefit year, with the resulting population average utilizing being a very modest 6 to 7 encounters under an evidence-based medical necessity review benefit plan. The problem is that there's no proof at all. There's no evidence that you only need 6 to 7 encounters. That's what they subjectively make, and that's where they make their millions and billions of dollars. Can you imagine that every patient that went into a chiropractic clinic was denied x-rays and were cut to 6.7? That's where they're making their killing. The fact is that when I encountered ASH about why are you not allowing x-rays, I was told by their senior vice president, Thomas LeBrot, he said this prohibition on spinal x-rays with the most specious reason, quote unquote, the diagnostic benefits of performing x-rays must be weighed against the risk of ionizing radiation. Excuse me? How many people do you know have been poisoned by ionizing radiation from the spinal x-rays? I've never heard of it, never seen it. It doesn't happen. But he just throws this fear-mongering out there, and somehow people, not the people, of course, I don't know, again, there's no insurance judge who might hear this, but many experts disagree with him. For example, Dr. Jerry Cutler, PhD, nuclear sciences and engineering in Canada, repudiated LeBrot's claim. Quote, if you go out in the real world, who do you know that's ever been harmed by low-level radiation? There's just no evidence of it. But yet, ASH does this with every patient it wants to. And again, there's no insurance judge or cop that might stop them. The same with the number of visits you get. Again, as I said, 23 chiropractic techniques use spine radiology to guide the clinical management of patients. Yet, what ASH wants to do is just go blindfolded in there and start whacking on you, I guess. This is absurdity. This isn't scientific healthcare. This takes us back before the advent of x-rays in 1895. Nonetheless, I'm not the only one complaining about this. They keep talking about evidence-based medicine to justify their draconian policy. The fact is, Dr. David Sackett, who is the father of evidence-based medicine, actually said, quote, some fear that evidence-based medicine will be hijacked by purchasers and managers to cut the cost of healthcare. Yes, that's exactly what ASH and other companies do, not just ASH alone. Quote, that results in slavish cookbook approaches to individual patient care without clinical expertise, which is the doctor's judgment as what the patient needs. Practice risks becoming tyrannized by evidence, and that's exactly what we're seeing here. It's not up to me or you what you may want. Nonetheless, that's why this new law was so important. Even the U.S. Representative DeFazio said the resulting squeeze puts pressure on providers to cut corners on service in order to increase the profits that the health insurers can extract. And that's what we see with ASH. While ordinary Americans are suffering through an unprecedented, deadly pandemic, multi-billion-dollar health insurance companies are boasting record-high profits. It makes little sense that these powerful actors should also benefit from an antiquated exemption, allowing them to evade all scrutiny and oversight by our federal antitrust authorities. And that's exactly what Dr. Sackett said when he said, a dangerous innovation perpetrated by the arrogant to serve cost cutters and suppress clinical freedom. And that, the profit I mentioned, how they doubled their profit in 4 years to $509 million, also was reflected with the amount of money that they're paying themselves. The average mid-management executive level at ASH makes $229,000 a year. That's a mid-manager, $229,000 a year. And that goes up to $700,000 for the highest executive. That's the paid salary. The president, the owner, the CEO of ASH, you can't find his salary because it's a privately held company. But just to give you a ballpark figure, I found another article that said the average insurance CEO in America at this moment makes $18 million a year. And the highest was $83 million. So again, all this money people are paying in for healthcare that they think they're going to get back in service, no, it's going to these executives who are lining their own pocket with incredible amounts of money. So let me ask, why would any accomplished student, why would he or she want to go into healthcare as a doctor or a chiropractor or a dentist when you could go into the insurance end of it and make 3 times more money? It's just out of whack. But that's what happens when you have a monopoly. And that's what health insurance is. It's a quasi-monopoly because these groups get together, collude, what are we going to charge, what are we going to do? They cut claims and they all do it together. And so what can you do? You have nowhere to turn. There's no real competition because they're all in cahoots together. And that's why this law was so important. And we're going to be seeing more of this. But I just wanted to give you the heads up that this new law will start having an impact. But hopefully the associations actually do something, because we saw what happened in 1964 when they passed the LBJ signed the Civil Rights Act, is that it didn't stop racism, it didn't stop discrimination against people of color and black or brown, whatever. It just was a law in the books, and it took a lot of protest by Martin Luther King Jr. and others to really imprint upon the American public. And here we are, how many years later, and we're still fighting for equality. And the same with healthcare. In 1987, an attorney by the name of George McAndrews, he fought and won a chiropractic battle against the AMA and 23 American Medical Association cohorts. And he won because they were keeping chiropractors out of a public hospital for no good reason, other than they wanted to monopolize it. The thing is that if it's a public facility, a public licensed practitioner should be able to go in and apply for the right to care for people who want chiropractors. I've applied it to the local hospital here in town, and boy, did I hit a kangaroo court. It was amazing. And so it's a battle, and it's been a battle since that court case was won, and it's going to be a battle with this. But keep in mind, things are going to be changing. The sooner the better, because American healthcare is among the worst in the world. There was a study done by Commonwealth Fund back in 2014 where they compared the 12 top industrialized countries of the world. And of course, America was number 1 in terms of cost at about $10,000 per American is what we spend each year on healthcare, or I should say sickness care. On the other hand, in terms of access, equity, all the other 11, there were 12 different factors, we were at the bottom. The only thing we led was in the cost. Otherwise, we were overall, the United States was at the bottom of this top 12. Guess who the top country of the world overall was? You'll never guess. United Kingdom. See, this is the thing that the medical association and the healthcare insurance companies don't want you to think there's a better way to administer and deliver healthcare in this country. Because whenever you bring up socialized medicine, oh no, that's bad, that's terrible. No, it's not. If you look at the statistics, as I mentioned, the Commonwealth Fund, go look it up yourself. No, it actually works better. And nonetheless, there's not as much profiteering, that's for sure. The heads of those countries are making $18 million for the national health insurance that they're selling. Doctors aren't getting paid $250,000. It's just amazing. The American system we have is a big ripoff. It's been a monopoly. They've enjoyed the fruit of that monopoly, but you're the victim as well as the practitioners that are not getting the equitable due in terms of what we should be if this was a free marketplace, and it's not. It's a rigged marketplace, and it's time to drain the medical health insurance swamp. So maybe this new law will help. If you have any questions, give me a call. Otherwise, thanks for listening.